gentlemen, let's get started now. Good afternoon, everyone.
Good afternoon.
How are you today?
Fine.
First of all, let me introduce myself. My name is Cindy Christin Isabela Sinaga, and people usually call me Cindy. I am a nursing student of PGI Cikini Public Health College, and now I'm in my 4th semester. Well, ladies and gentlemen, first of all, I would like to say thanks to the distinguished guest, the coordinator of English program here, Ms. Eltania Giovanni, along with all my fellow students here. And the last but not least, my special thanks will also go to my beloved teacher, Mr. Ramli Wijaya, who has given me an opportunity to speak here. Thank you for coming today. It's great to see you all here. Well, ladies and gentlemen, today I'm going to speak about Addison's disease. Once again, Addison's disease. And I have divided my presentation into 3 points. The first point is, what is Addison's disease and how Addison's disease occurs? The second point is, signs and symptoms of Addison's disease. And the last point is, Addison's disease treatment. Well, I'm going to speak for about 10 minutes, so everyone, would you mind leaving any question until I finish it, please?
Yes.
Thank you. Well then, let me elaborate them one by one, and I'm going to begin by telling my first point, that is about what is Addison's disease and how Addison's disease occurs. Now, please look at the picture on the screen. There is our kidneys, and above our kidneys, right there are glands which called adrenal glands, which produce the hormones cortisol and aldosterone. Well, Addison's disease is a rare condition that happens when the adrenal glands doesn't make enough of the hormones cortisol and aldosterone. So, Addison's disease occurs because the body is not having enough of the hormones cortisol and aldosterone. Cortisol is a hormone that helps our body respond to stress, including stress by illness, by injury, or surgery. It also maintains our blood pressure, heart function, immune system, and blood glucose or sugar levels. Aldosterone is a hormone that affects the balance of sodium or salt and potassium in our blood. This controls in amount to fluid our kidneys to remove as urine or pee, which affect our blood volume and blood pressure. So these two hormones play an important role to manage our blood pressure. So that's why mostly people with Addison's disease have low blood pressure. Well, let's move on to the next point, that is about signs and symptoms of Addison's disease. And these are 4 signs and symptoms of Addison's disease. The first is fatigue. People with Addison's disease get tired easily than others. And the second sign is hyperpigmentation. People with Addison's disease have hyperpigmentation on some parts of the body. For example, we can see the picture on the screen. Some of them have dark gums, or some of them maybe have dark eye circles, even if they have enough of sleep. The third sign is hypotension. Like I mentioned earlier, that mostly people with Addison's disease have low blood pressure. And the last sign is weight loss, because not having enough of the hormones cortisol and aldosterone causes our body metabolism to be disrupted, which can cause us digestive disorder, vomiting, nausea, and loss of appetite. Well, ladies and gentlemen, this brings me to my final point, that is about Addison's disease treatment. the important thing that I found about Addison's disease is Addison's disease cannot be completely cured, but we can be managed with hormones replacement therapy. Cortisol replaced with hydrocortisone and aldosterone replaced with fludrocortisone. And this therapy carried out throughout the life. So mostly people with Addison's disease can completely cure for throughout their life. Well, ladies and gentlemen, to sum up, there are two most important things for us to remember. The first is Addison's disease is a rare condition that happens when our body it doesn't make enough of the hormones of cortisol and aldosterone. And the second one is Addison's disease cannot be completely cured, but we can be managed with hormones replacement therapy. Well, ladies and gentlemen, I think that's all about my explanation today. Do you have any question to ask me now? If you do, I will try to answer your question. But due to our limited time, I will open this session only for 3 questions.
Yes. Yes. Any question?
Yes, please.
Okay, my name is Cindy Christin. I want to ask you why addiction diseases cannot be completely cured. Thank you.
Okay. Thank you for your question. Let me try to answer your question. Why Addison's disease cannot be completely cured? Because Addison's disease is happen when the adrenal glands doesn't make enough of the hormones cortisol and aldosterone. Damage in our adrenal glands is caused because autoimmune disorder. Like we know, autoimmune disorder it cannot be completely cured. So that's why Addison's disease cannot be completely cured. Any more questions?
Yes.
Yes, please.
My name is Awanda. I want to ask you, at what age can Addison's disease occur?
Okay, thank you for your question. Let me try to answer your question. Addison's disease more often occurs to people with age 13 to 45 years old. Why? Because in this age, autoimmune disorder is easily to happen. So that's why mostly people get easily to have Addison's disease. Thank you. Any more question?
Can Addison's disease occur in children?
Thank you for your question. Let me try to answer your question. Autoimmune disorder is not only happen to adults, but can be happen to children. So, although it's rare, but children can get it. Any more question? Well, ladies and gentlemen, if you don't have any more question to ask me now, I think that's all about my presentation today. And thank you very much for your attention, for your time, and for your coming. And God bless you all.